Hypertension, also known as high blood pressure, is a condition where the blood pressure against the artery walls is higher than normal for a long period of time. Blood pressure is the pressure of blood against the artery walls as it pumps through the body. Blood pressure is determined by the amount of blood the heart pumps and the size of the arteries. Optimal or normal blood pressure is 120 over 80 millimeters of mercury. High blood pressure can damage the arteries and lead to life-threatening conditions such as heart disease and stroke. There are many different types of hypertension. Primary hypertension has no identifiable cause of high blood pressure and tends to develop gradually over many years. Secondary hypertension is high blood pressure caused by an underlying condition. It tends to appear suddenly and causes higher blood pressure than does primary hypertension. Malignant hypertension is extremely high blood pressure that develops suddenly and rapidly and causes some type of organ damage. Risk factors for hypertension include age, race, family history, obesity, lack of physical activity, tobacco usage, stress, chronic conditions, too much sodium, too little potassium, too little calcium, and too much alcohol. Treatment for hypertension involves lifestyle changes and sometimes drug therapy. One of the most important lifestyle changes for hypertension is a new diet. This treatment has been made more effective by Dr. Michael Tordov's mouse research in 2007 and 2008 on genetic influences on calcium and sodium levels. Calcium is important for healthy blood pressure because it helps blood vessels tighten and relax when they need to, by keeping the smooth muscles that line the blood vessels toned. Too much sodium in someone's diet can cause their body to retain fluid, which increases blood pressure. Before Dr. Tordov's research, scientists understood little about the factors that make people seek out or avoid calcium and sodium-rich foods. Deciding to take a genetics-based approach, Dr. Tordov and his team of chemists characterized the calcium and sodium preferences of mice from the 40 core strains in the mouse phenome database. They found that calcium intake in the 40 mouse phenome database strains depends on strain, sex, type of calcium anion, and calcium concentration. In 11 strains, females preferred and consumed more calcium than males did. 9 strains preferred calcium lactate over calcium chloride, but only 1 strain preferred calcium chloride. Some strains preferred calcium solutions over water, while others consistently avoided calcium solutions. While they found that calcium intake is not significantly correlated to blood pH, blood ionized calcium concentration, plasma total calcium concentration, bone mineral density, and bone mineral content, they did learn that calcium-loving strains generally have extreme phenotypes for these variables. They found similar results with sodium intake in the 40 mouse phenome database strains, with intake depending on strain, sex, type of sodium anion, and sodium concentration. 9 strains preferred sodium over sodium lactate, but only 1 strain preferred sodium lactate. The other 30 strains showed no preference between sodium and sodium lactate. 11 strains ingested low levels of sodium. 4 strains preferred sodium solutions to water, while 4 other strains showed no preference. The characterization of calcium and sodium taste preferences in these strains allows scientists to perform QTL analyses and discover the underlying genes in mice and humans. Understanding the genetic mechanisms of calcium and sodium preference allows health professionals to potentially influence their patients' eating habits for the foods containing these minerals. This is important for health professionals developing new eating habits for their patients with hypertension. By knowing their patients' genetic tendencies, they can suggest foods that provide them with the minerals they need and steer them away from foods high in the minerals that they tend to overconsume. This method has directly impacted my grandfather's management of his hypertension. After treating it with medicine for years with little results, his doctor decided to create a specialized diet based off of his tendency to consume or not consume certain minerals. He even explained to my grandfather that we've recently learned that everyone has different genetic tendencies to consume different minerals, and that is why he craves these foods despite knowing they will harm him. His blood pressure lowered significantly after only a short time on this new diet, and he no longer has to worry about heart disease or strokes. This is why I celebrate the mouse.